Good day, everyone. Today I will be discussing or I will be reading the information about the post war year and the social welfare administrations. The post war years. In August 1948, President Quirino created the President's Action Committee on a Social Amelioration, or what we call PACSA. Is a comprehensive program of health, education, welfare, agriculture, public works, and financing. 1948, the United Nations International Children's Emergency Fund, or what we call UNICEF, became active in the Philippines, establishing basic health care services to mothers and children, consisting of medical care, feeding programs, and health education. 7 social workers who are trained in the United States, and this is Minerva G. Laudeco, Olympia U. Lozano, Carmen M. Luz, Josefa J. Martinez, Agapita Morillo, Flora R. Palomar, and Felicidad A. Silva organized the Philippines Associated of Social Workers in 1947. The organization was incorporated in 1948. It was in 1950 when a professional course in social work was offered in the Philippines by Philippine School of Social Work or PSSW with Josefa Jara Martinez as its first director. It was a one-year graduate program, Master of Arts in Social Administration or MASA. Then another year was added to MASA graduate who decided to pursue another year to be covered with a Master of Science in Social Work degree. Another schools started offering the graduate program in social work aside from the PSSW, such as the University of the Philippines and the Central Scholar University. Later on, these schools started offering undergraduate courses focusing on the social work with different nomenclature such as Bachelor of Arts in Social Welfare, Bachelor of Science in Education, major in Social Work, and the Bachelor of Arts in Sociology, major in Social Work. Later on, based on the recommendation of the Social Work Education Committee, schools were allowed to offer the Bachelor of Science in Social Work or the Cordero 2000 de Guzman 1971A. Now, we were starting to discuss to you the information about the Social Welfare Administration. In January 3, 1951, the Social Welfare Commission and the President's Action Committee on Social Amelioration were fused into the agency called Social Welfare Administration. Division of Public Assistance. This office has 2 programs. Number 1, assistance was given as material aid like food, financial aid, transportation aid, medical aid, institutional care, and work relief. Number 2, service was rendered in the form of rehabilitation service and administration and supervision of rehabilitation projects and workshops. Another important arm of the Social Welfare Administration was its Child Welfare Division. Casework and guidance service for children are under this unit. And to be part of the Social Welfare Administration, there are divisions on rural welfare. And this was created by Administrative Order Number 7 on September 5, 1951. It deals with the mounting social problems in rural areas, self-helps, became the underlying philosophy of rural community development projects. And in 1954, Social Welfare Administration was recognized. In 1949, Council of Welfare Agencies of the Philippines formally organized in 1952. And in 1988, became the National Council of Social Development or the NCSD Community Chest of Greater Manila. And to continue about the Social Welfare Administration, the council was established to A. Study the defined social welfare problems and human needs, to develop a coordinated plan of action to meet these needs, to help improve the standard of social service, and to serve as the National Committee for the International Conference on Social Welfare. In 1965, RA 5416 Social Welfare Act elevated the SWA to the Department of Social Welfare Programs. And one of this is the preventive and remedial programs or service for individuals, families, and communities, and to protect remedial and developmental welfare services for children, and trainings, research, and special projects.
So, the Commonwealth period, the Filipinos taking over reins of government during Commonwealth period specifically helped. Welfare programs were expanded and improved new services were organized such as rural charity clinics, quarantine services, home for mentally ill, defective children as for the aged and infirm and welfare veil. So during the Commonwealth period, Filipinos began to take control of their own government under President Manuel L. Quezon. This era focused on improving the lives of the people through health and welfare programs. The government built clinics, quarantine stations, and homes for the mentally ill, children with disabilities, and the elderly. So these efforts showed that the Commonwealth government cared about the well-being of citizens. So during the Commonwealth period, Filipinos began to take control of their own government under President Manuel L. Quezon. This era focused on improving the lives of the people through health and welfare programs. The government built clinics, quarantine stations, and homes for the mentally ill, children with disabilities, and the elderly. So these efforts showed that the Commonwealth government cared about the well-being of citizens. President Manuel L. Quezon, working for social justice, prevailed upon the National Assembly to pass the anti-usury laws, 8-hour labor law, laws fixing minimum wages, laws related to insurance, pensions, and women and child labor. In 1940, the office of the Commissioner of Health and Public Welfare was abolished and replaced by a Department of Health and Public Assistance Service, which took over the activities that used to be performed by the associated charities, which by then had ceased to exist. So in this slide, Manuel L. Quezon focused on social justice and workers' rights. He introduced laws such as a 8-hour workday, minimum wage, and protections of women and child laborers. So in 1940, the government also improved public health services by creating a Department of Health and Public Assistance. These reforms that Quezon shows a goal of building a fair and caring government rather for us Filipinos. The Japanese occupation. Second World War, which brought death and immeasurable suffering to the country's population, was to last for 3 years from 1942 to 1944. Social welfare activities during the period consisted mainly of giving medical care and treatment, as well as food and clothing to the wounded soldiers and prisoners, and also the civilians. The Bureau of Public Welfare, which was closed when the war was broke out. It was organized by the Executive Commission and instructed to attend to the general welfare of the residents, and to give food and comfort to released prisoners for concentration camps. So, during the Japanese occupation from 1942 to 1944, the Philippines went through a very difficult time because of the World War II. Many Filipinos suffered from hunger, fear, and even death. Still, there were efforts to help people through welfare activities like giving food, clothes, and medical care to wounded soldiers and prisoners. And also for the civilians because they are affected of the World War II. So the Bureau of Public Welfare was also recognized to continue helping and comforting those affected by the war. So these are the social welfare activities during the period. Number one is the relief work done by private organizations. It is the Philippine Red Cross, Young Women's Christian Association, National Federation of Women's Leagues. Next is the hospitals. It is the Philippines General Hospital. Second is the St. Luke Hospital, Mary Johnson Hospital, and North General Hospital. Next is the other relief agencies. First is the Emergency Relief Office, Emergency Commission Administration, Philippine Civil Affairs Unit, Philippine Relief and Trade Rehabilitation Administration or PRATRA, United Nations Relief and Rehabilitation Administration or UNRWA. So, during the Japanese occupation, these are the different groups help Filipinos affected by the war. They also provide and help in rebuilding the country after the war. Next is the post-war years. In 1946, the Bureau of Public Welfare reopened, but lack of funds limited its operations. Then, the United Nations International Children's Emergency Fund was created by the United Nations General Assembly to further maternal and child health in economically underdeveloped countries. In October 4, 1947, the Bureau became the Social Welfare Commission and was placed under the Office of the President. So, during the post-war years, the Bureau of Public Welfare was reopened in 1946, but its work was limited because of lack of funds. The same year, UNICEF was established by the United Nations to support the health and welfare of mothers and children in poor countries, including the Philippines. So later on October 4, 1947, the Bureau was reorganized into Social Welfare Commission and placed under the Office of the President to strengthen its programs and services.
Hey there, Jennifer here to continue the reporting. I'm in slide 31, which is the Social Welfare Administration. So, former head of the Department of Social Work of a Catholic university, the University of Santo Tomas, Maria Calao Katigbak, became a senator who pushed for the law regulating the practice of social work here in the Philippines. The Republic Act of 4373, an act to regulate the practice of social work and the operation of social work agencies in the Philippines and for other purposes, was approved by the Congress of the Philippines in 1965. This law stipulated that a social work graduate and applicant for social work examination should have finished 1,000 hours of direct practice under the supervision of a registered social worker. So RA 54616 of 1968 empowers the department to: number 1, set the standards and policies. Number 2, accredit public and private institution and organization. And third one is to coordinate government efforts in social welfare work to avoid duplication, friction, and overlapping of responsibility in social services. So, disadvantages. So, this is when the evolution of the Department of Social Welfare into a ministry reflected a broader shift toward community-based services and institutional development, supported by a growing presence of voluntary organization during the 1960s and 1970s. Next is the 80s. During this period, the Department of Social Welfare and Development, also known as DSWD, shifted from a traditional relief-focused agency to more development-oriented institution by enhancing programs like self-employment, assistance, introducing the case management system, and using social welfare indication to track the client's well-being, reflecting a preventive, participative, and client-managed approach to social services. In the early 1990s, the DSWD focused on 5 key program areas prioritized to put support for low-income and crisis-affected communities. And following the 1991 Local Government Code, devolved many functions to local governments, while retaining specialized services in institutional care, community programs, funded projects, and disaster response. Next is the Millennium Era. In 2006, the DSWD emphasized its strengthened commitment to pro-poor programs, while NEDA categorized NGOs into 3 operational levels, which is primary, the grassroots groups, secondary, the intermediate support organizations, and tertiary, or the umbrella or coordinating bodies. So let me explain briefly what is NEDA. NEDA, or National Economic and Development Authority, is the Philippine Central Planning Agency for Socio-Economic Development, while NGOs, non-governmental organizations, are private, non-profit groups that voluntarily work to support social, economic, or environmental causes. The past 2 decades. On January 24, 2017, the government's National Development Conference approved what now 2021 is the DSWD's Vision and Mission Statement, anchored with Ambisyon Natin to 2040, which is a long-term vision for the country. Let me read the vision for you. The vision. The Department of Social Welfare and Development envisions all the Filipinos free from hunger and poverty, have equal access to opportunities, enabled by a fair, just, and peaceful society. As for the mission, to lead in the formulation, implementation, and coordination of social welfare and the development policies and programs for and with the poor, vulnerable, and disadvantaged. Today, countless social agencies, organizations, and institutions under private sponsorship provide many different social services. NGOs play a very important role in supplementing the needs of the rising disadvantaged sectors in our society.
today, social welfare in the Philippines is much more organized compared before. Kay karon na natin mga government agencies like the SWD, many private organizations and NGOs who's providing services for education, health, housing, disaster response, children, elderly, and vulnerable groups. Dili man gid malikayan nga kulang gyud ang usahay nga kulang ang government support. But NGO is here to help fill the gap. So karon dili na siya puro community efforts. Nanay mga government laws, mga government system nga mag-help sa mga tao karon, nanay mga programs to help people effectively and efficiently and train professionals. So from a very simple community-based system back in the early times, currently we have more structured programs and institutions to help Filipinos and improve their lives.
That would be all, and thank you for listening. I hope it's clear to you, and up until next time. Bye.